I'm Jay Moran.
I'm Bridget Jaipal Valenza.
I'm Thomas O'Neill White.
I'm Angela Preston.
And I'm Lorenzo Rodriguez.
This is What's Next, a dedicated hour to have important conversations about the issues facing the marginalized and underrepresented communities of Western New York and Southern Ontario.
We're going to have some real healing. We've got to have space to tell some uncomfortable truth.
What's Next continues our mission to discuss race,
equity, and the common concerns of Buffalo's East Side
and beyond.
In the suburban area, everywhere, we must work and teach our children.
And good morning. Welcome to What's Next. This hour, we're going to take a look at the very troubling relationship that still exists regarding African Americans and the medical community. We highlighted at the top of the hour the story of Henrietta Lacks, a woman who died back in the early 50s of cervical cancer, but her so-called immortal cells were then harvested and were used for major medical breakthroughs. However, they were done so without her knowledge or her family's knowledge. This is just kind of a highlight of a topic that is going to be coming up this weekend for the Igniting Hope, Building a Healthy, Just Community for All panel discussion at the UB Jacobs School of Medicine and Biomedical Sciences. Leading that panel discussion will be our guest this hour, and that's the Reverend George Nicholas. So thanks for joining us.
Good morning. Thank you for the invitation. It's always good to be here.
And it's always great to have you with us for sure. We should also mention, of course, that you're the pastor at Lincoln Memorial United Methodist Church, but also the CEO and chair of the Buffalo Center for Health Equity. And your relationship here really goes back a few years to the African the task force that took a look at the disparities when it came to medical and health outcomes for African Americans here in the city of Buffalo. Can you take us back to that time, what it was like?
Sure. Yeah, I think it was 2014 or 2013, and a small group of us began to engage in conversations about colorectal cancer and the disproportionate number of African Americans who are suffering about that. And I challenged the group to let's look deeper. Let's look at all chronic diseases and seeing what's the story, what's going on in the African American community in this region. And so we began to look at data and outcomes and from the state and the county, and we discovered that if you were African American and you were living in the African American community, 5 or 6 zip codes we focused on, you would be 300% more likely to have a chronic disease than if you were white and lived outside of those things. So we're talking about diabetes and hypertension, different types of cancers and heart disease, and all these things that can they're preventable in some ways, or at least manageable, right? And the reason why we have such terrible health outcomes in the Black community and the health disparities exist, they're so pronounced that when you look at the state does an assessment of county health, what's the health of a county, and they look at all kinds of outcomes, that you would look to assess public health. And every year, Erie County, there's 66 counties in the state. Erie County consistently ranks 64, 65, one of the worst in the state. But then when you begin to look at the data and begin to pull out the poor health outcomes of the African American community, which makes up maybe about 12 to 14% of the county population, those numbers are so starkly they're so poor that it pulls the total number down. So when you look at the health outcomes for white people in Erie County, they're right around in the middle of the state, right? But the numbers for Black people are so significantly worse that it pulls the whole number down.
And just to be clear, when we're talking about Black people living in Erie County, considerably lower than, say, Black people living in New York City.
Yeah.
Rochester.
We have some of the worst in not only some of the worst in the state, but some of the worst in the country.
Wow.
Right here in the city of good neighbors, and it's been documented. And so we have been working on developing a kind of response. I think one of the first things we wanted to do is to understand the data and to understand why it is that way. A lot of times people will immediately jump to behavior, and behavior is part of it. But
wasn't that almost a cliche?
Well, yeah, I mean, that's what black people eat too much fried chicken and do whatever, and that's why you all got high blood pressure. Well, that's not necessarily the case, right? And so every leading health organization, whether it be the Center for Disease Control or the World Health Organization or any reputable medical school or that looks at public health, will tell you that what drives health outcomes are the social determinants of health, the lived environment. That will be 60 or 70% of the determination of what your health outcomes will be. So when you have great disparities in, for example, income and wealth, right? Well, we know here that in this country, the wealth gap is as bad as it's been in the last 40 or 50 years, where it depends on what study you read, but for every dollar of wealth that African American has, a white person will have $18. And so it's significant, right? And then when you look at educational outcomes, right, here in the city of Buffalo, people always talk about graduation rates, but that's one indicator. But another indicator, which I think is more important, is whether the child is at grade level, right? And there is no question, the data shows that African American children in the Buffalo Public Schools are 2 to 3 grade levels behind where they need to be, and the majority of them, right? Which will, education is one of the best indicators of potential economic advancement, right? And so now, when we have so much massive poverty on the east side of Buffalo in the African American community, it's tied to a lot of factors, but one of them is the factors of the educational outcomes, right? So you have great organizations like the Northland Training Center that will provide great opportunities for people to get training to get some pretty good jobs. But you have to be able to pass this thing called the TAVE test, right? And you got to be operating at least at the 8th grade math level, I believe. And so, and there's a challenge.
A lot of kids are being left out because of that.
Yeah, and it's not their fault, right? And I mean, see, we got to understand the distinction between a person having responsibility and whether or not something's their fault.
Okay.
Right.
All right.
Right. You know what I mean? And so, if we have a system which makes it exceedingly more difficult for a person to achieve, right? Well, achievement is connected to opportunity, and so if you're not providing the same opportunity for a whole subset of people, why would you believe that their achievement would be at the same level of people who do have those opportunities?
Right.
Right. And so what we ought to work for in this community is that the educational outcomes for children, African American children in the city of Buffalo and in other pockets too, would mirror the outcomes of white children in Williamsville and in Orchard Park and in Clarence. That's what we should be shooting for. I mean, and every child should have that right.
I was just going to say, does it frustrate you though when those arguments about just talking about school in general, and we're kind of getting off the topic, but I had an idea that if I was with you for an hour, we could get into a lot of different things about this, but that all of a sudden the argument becomes about, well, this is my district, this is what we pay, that kind of thing.
Ridiculous. I mean, there's a moral argument, right? That as responsible adults have a moral obligation to provide a kind of a community of caring for every child, right? I mean, we have that. That's just a basic moral responsibility in any civilized situation, right? And we got to stop blaming children for things that maybe they don't have as much control over as we think that and stop asking children to have Herculean efforts just to basically, be able to do the basic things in order to succeed, right? And so it's all about, what's important to us as a community. And so we know that if your educational attainment is not as where it ought to be, then it's going to be more difficult for you to get a good job, right? If you don't have a good job, it's going to be difficult for you in order to make the kind of income that's going to allow for you to purchase a home or rent a home that is going to be something that's going to provide a sense of comfort and security for you. Dr. Henry Taylor, in his report, The Harder We Run, documented the just dramatic disparities in housing quality on the east side of Buffalo. And we saw evidence of it, or the outcome of it, was when we had our blizzard. And while African Americans make up about 12 to 14% of the county population, we were 50% of the deaths from that blizzard. And we're looking at some other data with some of our partners with Healthy Link and others that are looking at hospitalization, frostbite, and hypothermia, and other things, and some of the emergency room data from that period. And we're finding just, in preliminary look that there was a disproportionate numbers coming out of certain communities. I guess you can guess what those communities were. And we know that, in terms of the housing stock and whether a home is properly weatherized and all these other things will have an impact on what happens inside that house if a blizzard hits, right? So for example, if the power goes out in a home that's at standard, whatever there are standards,
there are
right?
definitely standards, yes.
Right.
Yeah.
Then you can expect the maybe the home to get down to 55 degrees, 50, which is cold, for a short period of time. If it's not properly done that way. And if the electrical system and other weatherization pieces that you're supposed to have in a home that's at code, then that home will drop to 30 degrees. And again, Dr. Taylor speaks much more eloquently about this because he's done a lot of the data and done the research. And that's, again, attributed to public policy that has allowed for, housing standards to be at one level in one neighborhood and at another level in another, and then when you put into the equation income and rent, right? And if you're paying, I guess you probably want to pay about 10 or 15% or some 20% of your income on rent. But if you start paying, 40 or 50% of your income on rent, right? And then the unit that you're renting is not at code, right? Then it just creates a kind of uncomfortable and unhealthy environment, right? So now, just think about just the stress and that, folks have. And a lot of times these people are working people too, right? And so, but it's difficult in some places to kind of elevate yourself within the work environment you have, or find a place because you haven't had the opportunity or the access to the kind of training and other things that can elevate your skill level, right? Or maybe you don't have the time, right, to take that extra course because you have a child at home and you can't afford for childcare. All these different dynamics that just are these constant hurdles that people have to overcome. There's some people who do that, and great, and we applaud them, right? But that shouldn't be the kind of everyday existence for people in a community just because they're black.
Our guest this morning, Reverend George Nicholas, Reverend Nicholas from the Lincoln Memorial United Methodist Church. He's the pastor there, and he's also the CEO and chair of the Buffalo Center for Health Equity. We asked Reverend Nicholas to come in because he's going to be leading a panel discussion coming up this coming Saturday, the UB Jacobs School of Medicine and Biomedical Sciences. We'll get into that a little bit, but I'm appreciating how before we went on the air, you said you kind of looked at the city of Buffalo and some of the issues, the many issues that linger, especially for the black community, and there's almost onto there's this lacking of a comprehensive approach, and so we're getting into housing a little bit now. Maybe just for somebody who probably talks to a lot of different people, whether they're part of your congregation or others, What are you seeing with some of the housing around Buffalo?
Well, again, I mean, it's been documented. Dr. Taylor's report, right? And then and just driving through communities, or when I get a chance to visit some folks in their homes, and and these are hardworking people. They're doing the best they can, right? And you have all these vacant lots, on the east side of Buffalo, right? And you have some pretty high, rents are increasing for people, right? And so you have rents increasing, food costs increasing, but income's not increasing. So again, what do you think? That's a formula for disaster. We know that there are issues around lead in the air and water quality. All this has been documented, but yet what we haven't seen is the type of comprehensive plan. I applaud the group in the organization. I think there's a group that just got a federal grant to plant trees on the east side.
Right.
That's tremendous. I mean, and that's a tremendous first step because, certainly trees have an impact on the environment, right? And sadly, we found whole sections of the east side where, there were no trees, and they were cutting down trees, which I don't understand. You know what I mean? And
right.
so I think that kind of work is very, very important, because what's happening is we have these health outcomes, right? That in some places, people are living 10 to 12 less years if you live in certain communities.
Mm-hmm.
And that's just it's just not right. And then you also have the economic impact of, when you have the high costs of healthcare and the high costs of people who are struggling with chronic diseases and need very expensive treatments, right? And a lot of those things can be avoided, right? Or it can be diminished, right? If we make some pretty dramatic but achievable or doable, realistic adjustments in how we invest resources and what we prioritize in this community. So this is why it's so important for us to have this Igniting Hope Conference.
Okay.
This will be our 6th one. And what we've been able to do through this movement, right, is to...
You consider that a movement?
Yes.
You feel that
movement.
type of...
Yeah, it's got to be it, because that's the only thing that's going to bring change. So institutional changes don't come at a level that's impactful unless there's a movement that's pushing it, right? So systems are designed to sustain themselves, right? And so in order to get a system to do something that may be not directly impact its own ability to sustain itself, but is something that will impact other people, right? You have to. They're not good people. The systems don't do these things voluntarily. They have to be. They have to be pushed, quite frankly. And so by bringing these issues around health disparities up, and then pushing for health equity, and one of the, and here we clearly, that COVID wasn't a positive thing, but one of the positive things that came out of COVID. So I don't want nobody saying the pastor said COVID was a good thing. No. But that one of the things that came out of that was it shined a spotlight upon the African American community and began to show the disparities, because we knew that diabetes and asthma and heart disease and all these other things made people more vulnerable to COVID-19. Well, we knew that there's numbers in these communities were significantly higher than in the white community, right? And so we knew that this community was more vulnerable, and nationally, African Americans were dying at 2.5 to 3 times the rate of the populations in which they were coming out of. That was happening here in Erie County, but because we mobilized, right, and worked with county government, with with Kaleida, with Dr. Vasquez was a major player in this, and others. We were able to put the COVID-19 project in place, and we were able to lower the fatality numbers in this region to be in alignment with the population. And we're one of the few places in this country to be able to do that.
That's really a worthwhile effort to talk about it, because if I'm not mistaken, initially there was a reluctance by the African American community when it came to COVID vaccine, which kind of ties back into this Henrietta Lacks story that we highlighted at the top of the story. But talk about how that changed, because that's a big part of what you're talking about here.
Well, you have to have real authentic partnerships, right? So grassroots organizations in itself, just on the surface, their ability to make change there's a ceiling to that. Right, institutions which have massive resources, right, they have to be able to partner with grassroots organizations or community-based organizations to not only come up with the solutions, but to implement approaches together in order to address the problem. And that's what we were able to do. We were able to partner with institutions, government, private industry, and private in the medical world and whatever, and with churches where we had our call centers, right? And we were reaching out with the National Witness Project, a great CBO that was knocking on doors. And we just built, a team, an approach to address these issues. And I give the county executive a lot of credit for saying, hey, yes, I'm going to invest in this. He trusted his community partners. He says, okay, you have that kind of relationship with the community. You have a good plan. And so now we're going to invest resources in that. And it worked. And so, we have to understand that these problems have come as a result of generations of neglect and abuse. And we have to stop thinking that we can come up with some kind of slick programmatic effort to really dramatically change
something with a fancy name.
Yeah, it's not going to do it. It can be part of an overall approach.
Gotcha.
But there has to be a strategic way of doing things, and there has to be the necessary collaborations and partnerships with community-based organizations, community leaders, block clubs, whoever, right, who are on the ground, and institutions like hospitals and universities and government and private corporations that come together around a single table to say, how are we going to solve this problem? And so one of the things that came out of this Igniting Hope conference and out of this African American Health Equity Task Force is creating spaces, whereas we have three major outcomes out of this Igniting Hope, out of this going to our 6th year of Igniting Hope. One is the creation of the Buffalo Center for Health Equity, which I have the honor of being the chair of. And this is a community-based organization that focuses on research and programmatic development and advocacy and community engagement and policy, right? Then the University of Buffalo stepped up and created the UB Community Research Institute, which is going to focus on health disparities and health equity issues in the region and be able to mobilize its resources, especially around research, right? And then the County of Erie, through county law, through the leadership of Chairwoman April Baskin, right, created the Department of Health Equity within the health department by county law. So it's not something that
It's not just going to go away in the next administration.
No. And so they're again looking at policy and just published maybe about 6 months ago a tremendous health equity report around the health of Erie County and beginning to look at issues of disparity and putting numbers behind it, and then thinking about creative ways that we can begin to solve those things. So now we have three significant organizations. The three of us work together all the time. I think I'm on the board of the other two. You know what I mean? But more than that, it's the constant conversation and collaboration that came out of this Igniting Hope conferences, as well as many other things that are happening, at the grassroots level. And, we have, an organization like Highmark who made a 5-year commitment to the Buffalo Center for Health Equity, saying, hey, listen, we see what you're doing and we want to partner with you on that. And this is not like a kind of a grant like that is like something that you do a certain program, hand out some food or something like that. Yeah. And I'm not saying anything against those things. Of course. But this is a corporation saying, hey, this is a commitment we're going to make because we know the number. They know the numbers, right? And it's probably costing them money too in a lot of ways for all this sickness. So, but they also have a corporate and community obligation. Independent Health has been a great partner with us in a lot of this work. Univera, all the insurers, but we created spaces. And then when Population Health Collaborative was merged with Healthy Link, which has mostly about 90% of the health data, and we were able to say, because somebody was on the Population Health Collaborative board, was able to say, okay, if we're going to do this merger, then Healthy Link has to make health equity a priority, part of your mission, right? And they said, yeah, we ought to do that. And now Healthy Link is supplying data, and we're beginning to being able to look more precisely about the health in certain communities. So so this is all came out of, that's where we started in 2014 or 2013 with none of this, and now we're about 8 to 10 years later. Now we have going concerns that are working on this, and now this year we're going to have our 6th conference. We're going to be focusing on oral health, which is so important. And then we're also going to be talking about the historical issues of why people of color have issues with the healthcare system. And certainly having the Henrietta Lacks family, and we'll go talk about that.
Absolutely. We're going to take a short break. We'll come back with more with Reverend George Nicholas as we continue. This is What's Next on WBFO.
Hey, is this thing on?
Test, 1, 2.
Sounds great. Let's go.
The podcast world is overflowing with more than 750,000 podcasts to choose from.
But for great local podcasts, you can now go to one place, the new Amplify BTPM Pods app. Here you can discover content produced in Western New York and Southern Ontario, our own backyard.
With a wide variety of genres to choose from, there is something for everyone.
Listen to the best independently produced podcasts in the region, anywhere, anytime.
Download the free Amplify BTPM Pods app wherever you get your apps and begin exploring your local podcast community now.
Frida creates her greatest work yet in the face of bereavement and scandal. Watch Becoming Frida Kahlo tonight at 9 on WNED PBS.
You're listening to What's Next, our place to discuss the important issues of our communities of Western New York and Southern Ontario. We want to hear from you. Click on the Talk to Us option in the WBFO app, and we will work to get your questions or comments on the air. Do you have a story or concern that we should be addressing? Email us using whatsnext@wbfo.org. Together, we'll have the conversations that are needed. This is WBFO, your NPR station.
And welcome back to What's Next. My name is Jay Moran. With me, the Reverend George Nicholas, CEO and chair of the Buffalo Center for Health Equity, talking about the Igniting Hope conference coming up, Building a Healthy, Just Community for All. Pastor Nicholas, we did touch about this a little bit earlier on. Henrietta Lacks, a story from the early 50s. Quite a story in the sense this woman, unfortunately, African-American, she dies of cervical cancer. Her so-called immortal cells, though, get harvested and go and help with major medical breakthroughs. But the ethical part of that is nobody asked for permission, not from her or from her heirs as well. As a matter of fact, at the Igniting Hope conference this weekend, she will have family members as part of this discussion. Yeah. How do you see that playing out?
Yeah, we're going to really be honored to have family members from Henrietta Lacks' family to be joining us in our conversation for Igniting Hope. We got to get the time. It's Saturday.
Yep.
This Saturday from I think 8 to 3 or 8 to 4. You can go onto our website, buffalohealthequity.org, buffalohealthequity.org, and that will take you directly to where we need you. We're asking folks to register, and we're going to feed you. You're going to have lunch, snacks, everything. All you need to do is just come and bring yourself.
Okay.
And we will take care of all your comfort while you're with us. And the conference is free. We raise money so that we don't want any barrier for a person. I don't want anybody to say, hey, I was going to come to your conference, but. So we try to think about all the buts.
Sure.
And say, okay, there's no, just all you got to do is just go on to our website, buffalohealthequity.org, register, come on down to the Jacobs School of Medicine. It's on the bus line. It's accessible, and spend the day with us because I think it's going to be very, very important. And so the issue around Henrietta Lacks really, and the fact that immortal cells, and but yet her cells were immortal, but she wasn't.
Right.
Right. But the main thing really it makes me think about is just the relationship in general with people of African descent in this republic, and the issue around consent, and the issue around the valuing the humanity of Black people, right? And how, our humanity was robbed from us with the enslavement of our people since 1519, go back into the South and Central America and the Caribbean, and from 1619 to 1865 and really beyond. I don't think the Emancipation Proclamation was finally ratified in the state of Texas till like 1917 or something crazy number like that. And so you think about, the fact that people can feel they have the right to harvest your cells, right? Or the right to experiment upon Black women in order to develop the art and medicine and procedures around gynecology. If you think about all the experimentation upon Black bodies in the medical field, so the Henrietta Lacks thing was not the only thing.
No.
It's one of the most well known. It really just the issue of just consent and feeling like certain people feel like they have the right to take something as personal, as intimate, as a part of your body, right? Not only, so it wasn't enough to rob us of our culture, of our identity, of income, of our way we practice religion, all kinds of stuff. But now feeling like you have the right, the supreme right, and in some people's mind, a divine right, which is clearly it's not, to take that. And the fact that good came out of it is not relevant to the point of the process that occurred. And then when you think about the pharmaceutical industry and others who, wherever there's medical advancements, there's also profit.
Yes, that's for sure.
right. And so people made money off of this, but it wasn't Black people. And so there's some serious ethical issues that are related to, the Henrietta Lacks story. There are huge ethical issues around a lot of medical practices, and I use the word practice intentionally, and the relationship of people of color. And also, when you think about the development of vaccinations and other things that oftentimes, clinical trials and stuff may have only been done on people of European descent, and then the slight variation of between a person from European descent and African descent could have an impact on how effective whatever drug or thing was created out of it. So I think it's a really important conversation that we have now, so that we don't repeat this, because a lot of stuff when people start talking about AI and all this other stuff. Again, there's another opportunity. We got to have Dr. Jamal Williams from UB on. Because he's brilliant about this, and he does a lot of research about genes and cells and all this other stuff, and how this stuff, the medical world is going to really get really deeper into technology, but is it going to be designed only for people of European descent and not people of African descent? And it's trending that way, and so it's such a sickness, really, that we've had in this country since its inception, to devalue and undervalue people of color, and it's just we gotta break through. It has, at some point, it's got to stop. And go ahead.
And I don't want to take you away from the panel discussion and the event this Saturday, but at the same time, the Henrietta Lacks story, that's early 50s. Here we are today. What are we seeing with relationships with individual African Americans who are going to their doctor? What kind of relationships? Is there still that kind of lingering,
yes,
I know better than you,
absolutely
patronizing kind of thing that just, it's got to be a huge barrier when it comes to health?
Yeah, I mean, there's a number of books out, one called Medical Apartheid, that really talks about the relationships with doctors and other healthcare professionals and people of color, and the lack of listening and validating the humanity of the person that's sitting in front of you, and coming to assumptions about them just because of the color of their skin. And that's something that's, again, documented. It's a real problem in the healthcare world. And we see it a lot in the area of maternal health.
Okay.
Right. And so where, African American women are 3 to 4 times more likely to have poor birth outcomes than white women. And even black women who are professionals and have access to care and stuff have worse birth outcomes than white women that are living in poverty. It's just crazy, right? And a lot of that has to do with, again, stress and trauma of institutional and structural racism, the lack of prenatal care resources, but it also is related to, the relationships that a lot of black women have with their healthcare professionals. And even we've seen, Serena Williams, one of the most prominent black women in the world, almost lost her life giving birth to a child because her provider wouldn't listen to her. Beyonce had challenges when she had a child. And again, this notion that, when a black woman speaks, she doesn't know what she's talking about, even if it's related to her own body. And there's a reason why you don't see a lot of black people who are hooked on opioids and painkillers. Well, one of the main reasons is because black people are underprescribed.
Really?
Yeah, I mean, it's so deep. I mean, there's it's just this notion of just the lack of just seeing black people as human beings in this country, and seeing us as having the same wants and desires of peace and security and prosperity and the ability to care for our children and see them prosper and to care for our seniors. I'm on the master plan of aging for the state of New York, and just looking at how the issues of of dealing with aging in this state, and again the issues of disparities, and the challenges that our Black seniors are having that are more pronounced than what our white seniors are having around a lot of issues.
But can you give me some examples?
Well, again, housing,
right?
Quality of care in our daycare facilities, nursing home type facilities. I mean, as a person that gets around a little bit.
So you go to some of these facilities?
Yeah, and they're not equal. They're just not. And
is it disturbing?
It's extremely disturbing. And just access to affordable housing with support and services. And then we're thinking about how the wealth gap plays a role there, right? So if you don't have a lot of wealth and stuff saved up, then it's going to impact the level of care that you're going to be able to either provide for yourself or to provide for your mother and father, aunts, uncles, whoever, right? So that wealth gap, it kicks in a lot of parts of your life, but it really kicks in on a lot of ways when it comes time to caring for our seniors, because a lot of times, because of the journeys in this country, a lot of money that our seniors have saved had to be invested or given to their their children or grandchildren, to just basically survive.
Right.
And then when you see the disproportionate amount of African Americans that have engaged in the criminal justice system and the disparities in bail, people, they jump to so many conclusions about bail reform and all these other issues and student health, student loan stuff and all this stuff, and all these things have there's a disparity in the impact. I read a study once that said that like 20, 25 years after a person has graduated from college, about 90% of whites have paid off their student loans, and about 90% of blacks still are paying on them.
That's no way to accumulate wealth,
right? And so you have income gaps, wealth gaps. You have there are all these little hidden taxes, like for example, car insurance. If you live in a black community, you're going to pay a higher rate, right? So there are all these things, right, that press down.
And in a community like this, you have to have a car,
right? And so there's just all these things that just push. There's just this constant pushing down. There's data shows that the impact of systemic racism begins to break down your body. And so because stress, collective trauma. Think about the trauma that this community went through on May 14th, right? I think about this year, this summer, and I want to call her name Miracle Hunt. And Miracle was a 13-year-old girl who tragically lost her life when she was shot in the head on one of our streets in our community. And she wasn't out gangbanging. She was just hanging out. It was one of those hot nights in August or July or something. And maybe it was late, so what? And somebody had a gun and just whatever. And we live in a community when a 13-year-old girl, black girl, gets murdered. And maybe it's in the news cycle a day or two. A 13-year-old white girl in Orchard Park gets shot in the head and die. Something would happen. Something would change. I don't know what it would be, right?
Right.
But something, they would pass something or something, you know what I mean? And it's just the lack of just valuing human life of Black people. And you know, I preached the funeral and just seeing the pain and the anguish and the hurt of the people in that room that day, and especially the young people. And just thinking about just the trauma, you know, and thinking about when school started. And she was a student in one of the Buffalo Public Schools in which my wife works. And just the being re-traumatized again because it will come up with her classmates when she's not there.
Mm.
And so we have to change. What we're doing is not working. And it doesn't mean I'm not being critical of people who are doing great work. There's so many organizations that do great work trying to, as I put their finger in the dam. But we need systemic change, right? And that's what we're trying to build through this movement. That's what we call it igniting hope, because it's aspirational, right? We talk about the issues that we're going to talk about, not as a lament, but to get us to understand the seriousness of the problem so that our response will be as serious, right? And it's got to happen, man, because what we have now is not sustainable. We can't continue to have the things that we see in the Black community, and it just can't keep going on and on, because at some point it comes to a point of no return, right? And we don't want to get there.
When you talk about change, and obviously you've thought a lot about this because you probably have used the word change maybe 100 times in this conversation, every time raising questions for me, but is that change only going to come from policy change, or is it, that, and I hate that cliche, but changing hearts and minds?
Yeah, I mean, it's going to come when it's important to us, right? So I'll use an example. It was important to this community to have a new football stadium. So we're getting one. Why? Because the people that have the power and influence to make things happen said, this is important to us. So we're going to do it. When they wanted to build that Tesla plant, it was important to them, and we did it. When is it going to be important to bring equity into this region? When is somebody going to say, you know what, this is something that is important, not just to Black people, but to all people. It's important for all of us, right? That we don't want to live in a region where these dramatic disparities are part of day-to-day life, and that we just accept them as, well, that's just the way it is. It may be the way it is, but it's not the way it has to be. And the disparities that we see in this region are not because of divine action. It's because of human neglect. They don't happen accidentally. There's been some intentionality.
Certainly.
Around creating this stuff. So we have to, people of good conscience, and you know what's interesting, when I have these conversations, the vast majority of people agree with that we need to change. We need to do something else. I mean, people, they care. People, it's this notion that people don't care. That people do care, but they're just frustrated. They don't know what to do, right? And so what we're trying to do at Igniting Hope is trying to create these tables, create spaces where we can bring people. What's so great about our conference, when we break into small groups, you'll have business leaders, a college professor, a block club person, a youth, sitting around the same table, having a conversation about these issues, not about other stuff, but about how do we create this kind of place where every individual in this region has an equal opportunity to live a whole and healthy life. Why is that such a radical desire? Right? Why does that seem to be so impossible? Why does that seem to be so unrealistic? Right? And what we can't do is we can't afford to allow the people with privilege to dictate the time schedule or the timetable for change. Right? So it's got to be, there has to be a sense of urgency, because as we sit here and do this interview, there are people that are really going through some very, very difficult times and uncertainty about what the future will bring. One of the things we've seen around the mental health is we've seen a dramatic increase in mental health issues in the Black community, but also suicide. Right. So there was a time when suicide was so taboo in the Black community that really the suicide numbers were not high. But for some age groups and some cohorts, it's increased by 60 and 70% over the last 10 years. So, we have to become much more serious about these issues. We have to be willing to build the kind of collaborations and coalitions. My father's 97 and he's an engineer. And I love how engineers think. He always wanted me to be an engineer. Right? But engineers are problem solvers. And engineers look at what is, and then think about where you want to go. And then everything in between. What are the steps that we need to take to get to where we want to be? And you can't skip steps. You can't say, well, I don't really want to do this. But if you want to achieve the goal that you're trying to achieve, if you're trying to build what you're trying to build, you got to do all steps.
Do you think, and I hate to put you on the spot about political things here, but when you said you've got to know what the problem is, you've got to know where you want to go, is there just that lack of a vision, for lack of a better term, or a specificity in the vision when it comes to, this has got to happen. This has got to happen on Buffalo's east side. It can't just be.
It's not one thing, though. I mean,
I understand that, but is there a lack of that? We're getting there. This is where we're going. We're going to solve these other issues along the way and get there.
So at some point, yes, there is a complete lack of vision there. And I say that not to class dispersions at the people in position, but at the outcomes. It's all about, we got to stop being so thin-skinned and so emotional about stuff and just look at outcomes. Right. And if you came to my church and you had a terrible experience and something happened, I don't know, I would have to be accountable. I would say, look, I wouldn't blame somebody. I say, okay, I'm the pastor there. I got to figure this thing out. But I want to hear from you. I want to know, why was it a bad experience for you? And not feel offended and, or to discount what you're saying and say, oh no, that's not what really happened. No, this was your experience. And then try to take corrective action, to look inward. Right? And so we, as it relates to the issues around the Black community, we just have not had that conversation. We just haven't. And I can say that with great certainty because of the data, the outcomes, the things that you see.
The proof is there.
Yes. And so, but we take things, I don't know. We got to, at one point in life, someone had a conversation about, I want to create an iPhone. And the person who had that conversation at first didn't have he didn't know exactly how it was going to work,
right?
Or whatever. Didn't know all the steps, right? Sometimes when you raise these issues, people say, "Well, what's your plan? What's your plan? What's your plan?" I have plans, but why must I have the proverbial plan? the plan, right? When the person's created an iPhone, he didn't have the plan, but what it did, they created an environment to say, yes, we can do this. This is something that can happen. And so let's figure out all the things that we need to figure out in order to get there. And now today in 2023, you can hold in your hand a library, a movie studio, whatever, right?
You can make phone calls.
Right. But you know what's cool? You can make phone calls all over the world.
Reverend.
But you're telling me but then you can tell me we can't bring equity? Come on.
I'm going to have to stop you there because we're running out of time. Reverend George Nicholas, the Igniting Hope Conference this Saturday, right?
September 30th. Please go to BuffaloHealthEquity.org. BuffaloHealthEquity.org. Just log on and you'll get all the information to come. And we're really looking forward. You know what? We already have 280 people pre-registered.
Excellent.
That's
People do care.
Yes.
People do care.
Yes.
Reverend Nicholas, always a great pleasure.
Thank you.
This is WBFO and WBFO HD1 Buffalo, WOLN Olean, and WUBJ Jamestown, your NPR station.